Good afternoon, everyone. I'm Orange County Mayor Jerry Demings, and let me welcome you to a town hall discussion entitled Reopening Houses of Worship, Diverse Conversations and Perspectives to this town hall meeting. This is so far a meeting that we have over 280 individuals who have signed in to the town hall, so I do appreciate the broad community interest in this endeavor. Of course, we're living in some unprecedented times as the world is dealing with the COVID-19 pandemic, and it certainly has impacted us right here in Central Florida and within Orange County. We thought that it would be important that we have open dialogue with you today to talk about how we can mutually move forward in our community as we respond and recover from the pandemic itself. Before we move forward, I'm going to ask Pastor Jim Coffin to just share a word with us, a word of prayer invocation before we move forward on our agenda this afternoon. So, Pastor Jim Coffin.
We have a very diverse group of people who are participating in this program today. And so the invocation that I will give will try to recognize that level of diversity. And yet, despite the diversity, we have a unity and a oneness, because there are times in life where we must all be together. We must all sing off the same page. We must all pull in the same direction. And so it is the wish of every person who is here that we have a spirit of togetherness, that we have a wisdom that surprises even ourselves, and that we work together as a community to overcome the challenges that we face, and that all may be blessed because of our having worked together. This is our desire. Thank you.
And thank you. At this time, this town hall will be moderated by Jim Coffin and Pastor Roderick Zack. And I hope that by the end of our conversation today, all will be better informed about the circumstances that we have before us here within Orange County. And with that, I'm going to turn it over to Pastor Jim Coffin.
Thank you very much, Mayor Demings. It's a great pleasure to be with you, at least virtually, if not physically. And it's a pleasure to have all the people who are participating with us today. As you've already mentioned, my name is Jim Coffin, and I'm wearing two hats today. I serve on the steering committee of a little organization that's been going for about 5 years called the Central Florida Commission for Religious Freedom. And I also am the executive director of the Interfaith Council. The Central Florida Commission for Religious Freedom is a group that seeks to facilitate respectful conversation between people of diverse beliefs concerning religious freedom. And of course, the Interfaith Council seeks to work to pull people together, however diverse we might be, so that we can work together in a unified and harmonious way. And we seek to, in these two organizations, involve an array of people from different backgrounds, both faith traditions and humanistic. And the last program of this nature that we ran, we had 4 different faith traditions represented, one of them being a humanist background as well. And because of the logistical constraints and the time constraints, we don't have so much diversity of religion today, but it is still a high priority to us to make sure that everyone is included. I'd like to introduce one of the panelists that we have, Pastor Danny DeArmas, who's the Senior Associate Pastor at First Baptist Orlando, which is one of the largest, if not the largest, house of worship in Central Florida. And he serves that congregation, and that congregation during the pandemic has gone virtual. So Pastor DeArmas knows firsthand the kind of hardships that not only faith traditions have, but also secular organizations that likewise are made viable in great measure by their ability to come together and interact socially. And so we thank you for being with us, Pastor DeArmas. And now I'd like to turn over to my co-moderator, the opportunity to introduce himself and also the other panelists who will be participating today.
Thank you, Pastor Coffin. I'm Roderick Zach. I serve as the pastor of Rejoice in the Lord Ministries. I've been serving this community for the past 32 years. So I have a love for it and a heart for it. And I'm also the president of the African American Council of Christian Clergy, which is an interdenominational ministerial alliance, which has over 100 churches connected with it. But I'd like to say good afternoon to everybody. I'm excited. I do want to say that my list of registrars says that we had over 380 registrants for this, so we're excited about that. Like all of you, in the throes of mitigation protocols established by government and regulatory agencies, I miss the physical proximity to the people of God I serve. So social and physical distancing is difficult. It's not easy. So let me commend the faith community for your leadership and your love for community. It's evidenced by health and safety protocols implemented by you, which has helped to bend the curve in Orlando, in Orange County. And I am thankful for Mayor Demings and the medical and scientific professionals for their untiring work in helping to disseminate best practices for keeping us safe and curtailing the spread of the virus. I'm also thankful for Orange County for facilitating this town hall and the unprecedented unity that it represents. The opportunity for partnership and collaboration in this meeting avails the attendees who make up the faith-based community a great opportunity, and we appreciate the opportunity. I've been on the Economic Recovery Task Force for Orange County, watching and participating in unprecedented collaboration. Disney, Universal, SeaWorld, and small and large businesses sitting at the same virtual table, diligently working to devise solutions to the reopening dilemma. I'm excited about your input today as we engage in this conversation. So I want to present and introduce two folk, one of whom is Dr. Pino. Pino, he's an epidemiologist, and he worked for the Institute of Community Research, Hispanic Health Council, and Hartford Hospital. Dr. Pino graduated from the University of Havana with a doctorate in medicine and UConn School of Medicine with a master's in public health degree. And we've been seeing him giving our statistical reports and analysis in the press conferences. So he's the health officer for Florida Department of Health in Orange County. And then I'd like to introduce, and he doesn't need an introduction, but our Mayor Jerry Demings, law enforcement officer for many years, chief of police, and as well as sheriff for Orange County, elected to mayor in 2018, just doing a stellar job. We're thankful for his sacrifice and his input in this process. So those are our panelists.
Zach, would you like to have the doctor give us just an overview of where things are as far as the latest science? Okay.
Dr. Pino, you have the floor. Would you please share with us some details?
Okay. Yes, good afternoon. For those who have computers, you will see data that I'm going to present to you from the state, and this data is open to the public. So anyone who also may not have a camera, or in the future, later on, you can search for the Florida Department of Health website, and on top of the page, you are going to see COVID. When you hit that, you are going to get a lot of resources and data that you can have access to. So this first image is to give you a picture of what the pandemic is in the United States. All those dots in our country are counties, and if you hit any of those dots, you will get how many cases in that county, the name of the county, and etc. Let's see, this is In Arizona, it's called Apache. That county has 859 confirmed cases, and it have 12 deaths. Also to your right, you are going to see the global cases, about 4 million, the United States 1.4, the US death about 84,000, the global death about 299, 333. Yeah, just to give you a general picture, Florida cases, how are state doing? Florida has 43,000 cases. 42,000 of those are residents, and hospitalization, about 7,000 people have been hospitalized. It doesn't mean that we have 7,000 people hospitalized. I mean, during the pandemic, this number of people have needed hospitalization. And about 1,800 individuals have, unfortunately, died from the pandemic. For testing, testing is one of the efforts that really, really needs to be in place before we, and when I say we, I'm not just talking about the county, the nation, go into full-blown activity. Why? Because you have to have the ability to detect the disease as early as possible if we want to interrupt transmission. Where are we today in testing that we were not 5 weeks ago? First, we have more testing available, and the mayor and the county have made a huge effort, and the state too, to increase those numbers. And we are testing in good days more than 1,500 people a day, or receiving results more than 1,500 people a day. And days that we are the lowest, we are receiving about 500 new tests done a day. So we are doing pretty well. The measure that the state has set up is that about 2% of the population of our counties should be tested in a month going forward. And for that, we should have been doing about 1,000 a day. So average, we are doing fine. I want to also put emphasis in this number over here, the 3.9%, which is the positivity rate. That means how many of the tests that we are doing daily have become back positive. And this is an overall rate, 3.9. Just to give you an idea, when we were the highest, we were about 11%, and it has continued to decline. And yesterday rate, just for the day yesterday, was 1.6. The day before was a little bit higher at 3.6, but it's about the range that we have seen since we have seen a decline of the pandemic. And here on the top corner to your right, it is a curve in red. That is our epi curve. And as you can see, our cases continue to trend, new cases, in the right direction. Here you have our cases, age distribution, gender, race, and also a daily number of cases. And I mean, this is self-explanatory. And let me move to the other one. In this one, we can even detect the number of cases by county, by zip code, I'm sorry. This one is by zip code for our county. And if we click in any of the zip codes, it will bring us to the number of cases, or in this case, is Windermere. And these are some of the tools that we continue to use to monitor how the pandemic is doing. And this is probably the most important tools for us here, right here. And this is our daily health metrics. On the top, what we can monitor here is who are going to the ERs, what people are going to the ER force, and this is almost live, and also the positive cases that I just show you. So this is all the elements of the data that we continue to monitor and report to the mayor and to the community so that our political structure can make the decisions that are necessary to move our community forward. In general, the county is in a very good position. We are in a very, very good position, and the the future is in our control. We have control over this in the sense that we are the ones who transmit the virus. We are the ones who move the virus around, and we know what to do to interrupt that transmission. If we adhere to that, we will be successful. Our community has been amazing, and that's probably why we have seen so many good results in our county. We probably, of the largest counties in Florida, we are the one who's performing the best. And I'm proud to say that. The data continues to trend in the right direction. We don't see any major changes, and next week will be critical as we enter the beginning of the third week since we opened, to see if we have any impact. But our assessment is that we are moving in the right direction. Thank you.
Okay. Thank you. Pastor Coffin.
Okay. I would, granted that many of the people here are, most of the people here are connected with some type of religious organization. Others may be a secular organization, but it meets together in much the same way that a religious one does. What are the unique challenges or the unique risks that such organizations might face as opposed to just the ordinary business that's out there? Is there anything that that particularly should be observed and concerned about as people come together in this type of groupings and this type of activity? And I'd ask that of the doctor.
Oh, so the space and the closeness of people, the touching, the sharing, the peace, the hug, the singing next to each other without masks and emitting particles. And of course, services are different across denominations. So I'm being very general. And services across denomination may have different structures. But the reality is that the physical contact and the distancing is critical, as well as touching surfaces, the pews, going for the communion, sharing the communion for those who serve communion. And although there is not oral transmission that has been established, it could be that it's staying the saliva on surfaces. So that part I have not seen much of what can happen in places where you share utensils or the caddies or the chalice, different things depending on the denominations. But if we were to observe social distances, if the places will be disinfected, if we are masked, if we do not touch each other for the time being, some activity could resume if that's the wish of the denomination.
Okay. Did you have further questions, Pastor Zach?
Yeah, and then we want the group to start populating the chat with your questions. I do see one or two questions now, but I just wanted to follow up on this. I know there was a report by the National Institute of Health and a study done by the University of Pennsylvania that said that the aerosol droplets could remain in the air for 8 minutes after someone just said a phrase. The phrase that they used was "stay healthy," so I know with singing that must be like a phrase on steroids, especially if we're singing strong sometimes. So I just want to know further clarity on that. Yeah.
So the virus is heavy. It's a very heavy virus. Has a lot of proteins that surround the virus. All those little things that we see in the pictures that they put into those are proteins and those are heavy. So the virus tends to drop quickly into the surface, into surfaces. So I will look for the study and read if that was an average or that was an aberration about the 8 minutes of because I'm mean seems to be long. But you have viruses like La rubiola that can stay in the air suspended for hours. So the part of emitting the particle and having that barrier on the face mask is critical to decrease the number of viral load that people are putting out into the environment to the closest. And that's why we have talked about social distancing, because it's heavy. It doesn't really travel that far. So 6 feet is safe enough that it will not reach other individuals. Now, I don't know if any study have been done on singing and how might that affect that distancing, as it may project the particles a little bit further. But yes, it's, as you said, it's singing is on steroids. It's particle on steroids. And people get emotional and physically agitated, and that contribute to the whole increase of breathing and and the emission of particles as well.
Thank you, Dr. Pina. So we're going to move now to Lucas, facilitating the questions that are coming from you all.
Yep, so Pastor Zach, one question we have from Philip Taylor is, when is phase 2 of the reopening starting, which is a general question for all of us, for all of you to consider.
Perhaps I'll be the best one to jump in to address the phase 2. It is, at this point, it has not been specifically defined. When Governor DeSantis issued his executive order that took effect at 12:01 a.m. on May the 4th, during that order, he did not specifically indicate how long phase 1. We are currently in phase 1, and that began again at 5:01 a.m. on May the 4th, in which at that time additional businesses were allowed to reopen. Mainly, that was restaurants that could open at 25% of their internal capacity, and then in addition to restaurants, retail establishments were allowed to reopen again with this 25% limitation or restriction. For restaurants, they were allowed to open outside dining with appropriate review, if you will, by the local government. What our healthcare experts have said is that as we move forward in terms of the phases of reopening, there was a guideline that was instituted by the federal government, came out from the White House using CDC guidelines, and our governor here in Florida essentially adopted the phased reopening guidelines and approach. Generally speaking, each phase has to have a body of data that is collected by the healthcare experts, and which public sector decision makers will use to make decisions about moving towards additional phases. So phase 1 that we're currently in, generally speaking, limits gatherings to no more than 10 individuals. However, as it relates to places of worship, the governor had no mandate regarding the gatherings, the size of gatherings for places of worship. And many of you know that I issued a corresponding executive order here within Orange County. And again, it too indicated guidelines. There were no mandates for religious institutions. We expect that phase 1 would last for a 2 to 3 week period of time before the governor would announce when we would move to phase 2. As phase 2 would come forward, there will be an additional widening of the number or the size of the gatherings that would theoretically be suggested, recommended, allowed, etc. And so we're now waiting for Governor Scott, Governor DeSantis to make that determination of when will phase one begin. But suffice it to say, this is the second week of phase one. Phase two is the next phase, and it could begin as soon as a week from now, 2 weeks from now, or whenever the governor makes a decision to reduce restrictions. And again, that specific date is not known, but what he has done in the past is when he has put an order in place, he typically gives advance notice to the public, no less than 4 or 5 days. So as we approach the end of this week, it's likely that if he makes some decision within the next few days, it wouldn't take effect for at least another week. So that's as best as I can tell you, is that phase one likely could begin toward the end of this month. Not phase one, but phase two will likely be toward the end of this month, beginning of the next month. And then we will hold steady within phase two for a 2 to 3 week period of time while the healthcare experts gather data to see if there was any adverse impact on the spread of the virus with those with the relaxing of any restrictions. So a long way to answer your question, but I wanted to give you the full breadth of the theory behind the phase.
I'd like to throw in another question here or a first question for Pastor DeArmas. When the First Baptist Orlando decided that they would not hold meetings but would go virtual, they actually could have had some kind of meeting. There was no mandate that said you can't have any kind of meeting at all. And so they chose not to. And so I wonder, when it comes to reopening, is it just a matter of what mandates the governor or the mayor would give, or are there other considerations that would come into play as to whether you open up and how you open up? Pastor DeArmas.
Well, Jim, thank you for that. There would be other considerations, but right now, primary is what the government is saying at all levels, and we want to stay within that. We're driven more by our personal beliefs, and like everybody on this call is, and our desire to love our community and love the people who are part of our church. It sets a higher standard even than doing what government says. So we want to do what's safest. Now, at the same time, we really want to gather, and we really want to gather in a safe way. And I'm eager for us to have opportunities to gather again and put protocols in place so that we can keep people safe. But the other thing, Jim, things change so quickly in this environment. I try to keep all of our options open because I don't know today what the factors will be 3 weeks from now or whenever phase two comes. And so when that comes, I'd be really curious what kind of restrictions to size that they would give. And then it's possible at phase two, we would be ready to open depending on what those restrictions are. And, that's kind of where we are. By the way, I'll also tell you this, at our church, we've stopped using the term virtual to describe our online experience. I looked up virtual and it says almost like the real thing, but not. And our services are the real thing. They're just online. So a county meeting can be virtual, but a church service is online because it's for real.
Okay. Thank you very much. Lucas, would you like to bring in another question from the viewers?
Yes, sir. We have one from Judith that says, how is it going to be determined who is being tested? I'm sorry, let me ask her question again. How is it being determined who is tested?
So I guess I have to take that one. So each each site, each company, each private institution that is practicing testing, that is doing testing, can develop their own criteria as long as it is allowed by the lab. Um, the criteria right now from the CDC has changed as testing become available. More sites in Orange County has no criteria at all. In our case, and we are doing most of the, some of the big part of the testing, we can do up to 500 a day. Right now, it could change, as well as the county health services are doing very similar numbers, around 300 a day. We have no criteria. The only criteria is that the individual is 18 and older. And the reason why we have said that, and put it that way, because in our situation is a drive-through and child attestation and determining that the parent is the parent who say who it is not easy to do in that type of environment. Other sites, if we were to send the labs to the state lab, then there are some restrictions with regard to symptoms and the presence and the contact with a positive case. So there are some criteria that are more restrictive, but in general, we have no criteria at this point.
Thank you. I see two questions relative to kind of the resources that I want to put forward. One about serving food, whether that was advisable, and the other was whether the PPE, hand sanitizer, masks were to be made available to. I'm assuming to, for instance, in my context, we have smaller churches that some of them can't afford it or may not know how to access it. Is some of that going to be made available? It's for the panel.
I imagine the mayor would be a good one to answer that. Mayor Demings, would there be PPE available for congregations and groups of this nature?
Okay. This week we have received an additional shipment of personal protective equipment to include masks and hand sanitizer in. And so we will begin a process after we distribute to the small businesses of where we can, assisting both individuals and or places of worship, et cetera, the community at large, with additional distributions of the mask and the hand sanitizer that we have received. So our goal here is to assist those in our community as we reopen with everything they need to protect themselves, for the foreseeable future. And we have the limitation of a budget, but we're fortunate here that we have received some Federal CARES Act funding, and we're able to purchase the PPE and redistribute it within the community. So we have a number of other community-based organizations that have made donations of different PPE, and we have a process to redistribute that. So if there's a particular congregation that has a specific need, if you make that known to us, then we will assist in trying to get you what you need.
Thank you. And Dr. Pino, the second part of that question was there was an inquiry about serving food.
Again, could you repeat this?
There was an inquiry about, is it acceptable to serve food if they want some determination about serving food?
Yes, of course, if hygiene is observed and the conditions are proper like any time before, I'm pretty sure they have the experience about keeping it warm, keeping the temperature, wash your hands, cover, put gloves, And in this case, we have to add social distancing and masks. But sharing the food is absolutely fine as long as we keep those measures in place, of course.
Lucas, you can move forward with the next question.
Next question is from last name McCoy, and it talks about, since our facilities, meaning places of worship, need to be COVID-19 sanitized before reentry, is there any assistance on recommendations for churches of how to accomplish this? I know that we will have somebody on, Dr. Reverend Gabriel Saguro, who's put a good book and guideline for sanitation and for reopening. So I don't know if you would want us to maybe wait for that question until his turn, or have him tee up now.
Why don't we go ahead and just have him present that answer right now?
Okay. Dr. Saguro?
Yeah, thank you. Thank you for that question, Reverend McKay. Look, for us, in terms of the guidebook and manual that we put together, that's both in English and Spanish. I believe we to share the resources after the call. There's a few things that we shared. Number one is CDC compliance, and that's in that manual, together with handouts in English and Spanish that you can post around your facilities when and if you're going to reopen. And this is not unique to our tradition. It's faith tradition, humanitarian institutions. It's generic enough that it can be contextualized. We don't take a position on when you should reopen. We advise for you to keep in line with compliance with CDC and local and state guidelines. Number two, we have a hygiene section on what materials the CDC approves for disinfecting. And so you can just click right on there, and we have a direct link in that resource, both in English and in Spanish, on what is allowable. Number three, we have an outline on how to communicate the protocols to the people who gather either in your place of worship or your facilities. And so all of these things are around four areas. Reverend McKay, I believe you asked the question, is number one is, what are the protocols of communication and compliance? Number two, what are the protocols for disinfection, infection and hygiene in compliance with the CDC guidelines? And we have the attachments there. Number three, what are the protocols for what they call social distancing, what in our tradition we call physical distancing, because I think we're still connected as a society. We too, like First Baptist, we went digital. We call ours our digital communication. Since the beginning of the COVID-19 pandemic, we are still uniting digitally across our platforms, but we're also applying, and this last area, which is very important, how do we communicate with the vulnerable, people with pre-existing conditions, elderly people, or any high-risk communities. So all of that is included in the manual that was written by our coalition, and it's across faith traditions, and it is directly connected to both the CDC and the World Health Organization templates that you can use when you reopen. But the most important thing is that communicate, and do it with great clarity and repetition. And so we put that at your disposition, Reverend McKay, and everyone here. Again, English and Spanish, and you can contextualize it to your faith tradition or humanitarian tradition.
Thank you, Pastor. That's a very valuable resource that's going to be made available to everyone. And we also want to go through real quickly the guidelines that were established and voted upon by the Orange County Economic Recovery Task Force. There's seven general guidelines for all industries. So the first one is to practice social distancing.
We have that on the screen, sir.
Yeah, that's good. The first is to practice social distancing. The second is to stay at home when feeling sick. That's for staff, as well as to try to take an entry poll. You know, in some instances, you may do temperature checks. Wear protective face covering, number three. Number four, conduct health screenings. Again, this isn't an actual examination. It's just an assessment, just to ask a few questions. Has somebody been exposed to someone who has COVID-19, so forth and so on? And have you been out the country? Just a few questions that you might want to ask to assess the health of persons entering your facility. And then 5, sanitize and wash hands frequently. Number 6, high-risk individuals should shelter and work from home, or again, refrain from attending services whenever possible. If something, I think some churches are deciding to do separate services for that group, or try to cloister that group off in the church to try to give them some separate distancing. Number 7, recommend temperature check for all staff. Is their temperature, if they have a temperature of 100 degrees or above, they need to go home. So those are the 7. Those principles will be emailed to you as well as Pastor just indicated, to try to contextualize those principles where they're relevant for your congregation, your house of worship.
I'd like to just jump in and kind of go in a slightly different direction for a moment. And this is first to Mayor Demings, and then we'll go to Pastor DeArmas as well. But when the governor declared that houses of worship were an essential service, that caused concern, and I would say it kind of comes in the preferential consideration side. On the other side, when there's any suggestion of limitation on what house of worship can do, that gets decried as discriminatory, as some type of unfair treatment of the house of worship. So obviously different people are looking from different perspectives. And so, Mayor, as someone who has to make these kind of decisions, how do you weigh, the discrimination side versus the preferential treatment side? Is there a kind of a mental exercise you go through in making those decisions, or do you just have good counselors?
Well, I like to think that we try to exhibit some good common sense and making decisions, but you know what they say, common sense isn't common these days. But for me, the litmus test is what we're simply trying to do is to keep the public safe, inclusive of those who are parishioners at the various places, houses of worship. So our intent is not to regulate places of worship, but to give you some guidance. And that guidance is really wrapped in what the Centers for Disease Control, the World Health Organization, the Department of Health, et cetera, what they are telling us we need to do as human beings to protect ourselves and not spread the virus. We do know that there's some evidence that there have been clusters where the virus spread from congregations of religious worship. And because of that, we simply give guidance. The houses of worship should look at those guidelines and make their own decisions about how they move forward. My observation is that the overwhelming majority have the same interest in terms of protecting the public and keeping everybody safe. And when they have any types of meetings, they are doing the things that are suggested within the guidelines. Occasionally, there may be something, an occasion, an event that occurs, such as a funeral we saw this past weekend, where it did not appear that many of the individuals there were exercising any form of social distancing. They were not wearing masks, etc. And that created concern for many of the people in our community who observed that. And so, again, we can only suggest to you that these are guidelines that we're following. You've heard from Dr. Pino today that kind of gave you a little bit of the medical science behind it. I heard something even today in the news this morning from a physician who had contracted the disease, and he had been going in some high-risk settings as a physician, administering medical care to individuals who had tested positive, and then he himself tested positive and had to be hospitalized and ended up in a critical care unit. It appeared that he was recovering, but he went so far as to say that when they asked him how did he think he may have contracted the disease, he said something startling to me. He said that while in many cases we cover our mouths and et cetera to prevent from spreading the droplets throughout the air and the environment that we're in, he thought that maybe because he had been masked up, but at some point was not wearing any type of facial eye protection, that he went so far as to say he believes that he could have gotten it through his eyes, through a droplet that went into his eyes. And so it is something that is real. There are some people who live amongst us who think that this isn't real. This isn't something that they really should be concerned about, that is no worse than the normal influenza. But for the last few weeks, I have now had the opportunity to talk with numerous families who either have a relative who tested positive or who died. Within Orange County, we have 36 individuals, known individuals at this time, who have died as a result of the virus. So we know that it really is real. And so for houses of worship, like any other place, whether it be a restaurant or what have you, the reason why I think the governor made a mandate with the restaurants that they shouldn't exceed 25% capacity within the interior of their business, he said that they set no such guidelines if they were outside in open air or under tent. And I think that that's an area that perhaps Dr. Pino can speak to about whether the risk goes up when you're inside a building. I see one of the chat questions is related to, can it be spread through an air conditioning system? Are you less likely to contract it if you're outside? And so I'll let the healthcare professionals respond to that, because they have been tracking some of the cases of individuals who tested positive to try to understand better about the virus itself and how it operates. So, Dr. Pino, could you piggyback a little bit on some of what I've said here about the reality of the virus?
So 2 points, Mayor. It hasn't been determined yet. So far, they think that it doesn't travel to AVAC systems. But there was a recent study of transmission in a restaurant where there was clearly, the person was behind the flow of the air, and the air did travel 2 tables across in a restaurant and infected several people in table 1, the closest, and a couple of people in table 3 that was on the other side, quite distant from where the source was. So yes, the particle has the ability to, seems to be moved by airflow in a closed space. With regard to the outdoors, it's preferable in many reasons, because you can keep better social distancing, you're not limited by the structure, and you don't get into the possibility of being transmitted through the flow of internal air conditioning or other systems. But the reality is that wearing a mask and keeping social distancing and hygiene, those are the 3 key elements that we have to observe, especially in elderly people with pre-existing condition, which is a good part of the flocks of many of our churches and houses of worship.
Thank you, Dr. Pino. Thank you, Mayor. I just wanted to mention that even though it's obviously we're not going to get to all the questions, but we do plan to devise a response to all your questions and get that back out to you. We do plan to send a template that's been developed about the protocols and best practices for houses of worship. And we also would like to know if you have developed a resource. We would love to be in receipt of that. You can send that to us. I see some suggestions here. Anytime, any suggestions that you might have about the process, we would welcome that, and we'll compile that as well and get that out to everyone as well. The next.
Oh man, yeah, Pastor Zach. We have a comment and a question from Imam Tariq Rashid. Mayor Demings, on behalf of the Muslim community of Orange County, I would like to thank you for organizing this very important town hall meeting. His question is, at the end of Ramadan, Sunday, May 24th, Muslims offer a special prayer in the morning called the Ayat prayer. I apologize if I mispronounced that. This prayer is held in the open, not inside the mosque. Usually we pray at the parking lot of the Islamic Center. This year, we would like to do the same with social distancing and with masks. Would this be fine?
As long as there's social distancing, it likely will be fine because that's depending upon the numbers that you're talking about. You can kind of figure out the spacing that you would need. It will be no different, if you will, than what we're allowing to go forward with outside dining, where small groups are able to sit at tables, and then there's a distance in between the tables. So there's nothing that we would do that is going to prohibit that. Again, you should look to the CDC guidelines and how that really should move forward. But I don't believe that our physicians will say otherwise, but I can't speak for them. Dr. Pino, any additional information that you want to chime in?
No, I do agree with you, Mayor.
Just with an abundance of caution, if you look at some of the guidelines that are recommended, if you ask some of the questions, if you do some of the temperature screenings, you have the social distancing between your congregants, it likely should be fine.
Okay, we can move to the next question.
Okay, this is from Dr. JER. If it's lawful for restaurants and retail stores to operate at 25% of their building capacity, excluding employees, and acceptable for them to seat parties of 10 or fewer, churches should also be permitted to seat parties of up to 10 together and hold services for 25% of their building capacity. To adopt and interpret any other interpretation with credible scientific explanation disadvantages religious institutions. So that's more of a comment than a question. I apologize. One question we have is, has anyone checked with their insurance company about liability in terms of hosting services?
If I may, our coalition has about 3,000 churches, and we've actually done this work. And insurance companies, now we're a national coalition, but we have several hundred churches in Florida, and our church is personally in Orlando. So the church, we pastors about 5,000 people. And so what we have recommended for the pastors and not-for-profits in our coalition is to check directly with the insurance company, because the responses have varied from insurance company to insurance company. And again, that's kind of a straw poll from across the country and several dozen churches in the Central Florida area. And so our recommendation is to call directly to your insurance broker or your insurance company to see what protocols they've put in place since COVID-19.
And I just want to mention, even though some entities might suggest a percentage of your congregation, I think it still should be based on how you schematically work that out for social distancing, not just the arbitrary percentage.
Yeah, and Pastor Zach, I want to echo that. I think like I said, Pastor DeArmas and myself, one of our, I think, primary values is kind of like the Hippocratic Oath, no harm. And we're trying to bend over backwards to keep in compliance with the CDC. So our church fits about 4,000 people at a time, but with social distancing, that will significantly decrease the number of persons. If you have six feet between persons, you have the mask, all of the protocols that the CDC says. Now you're significantly decreasing. Even if you choose to reopen, the social distancing remains in place, and so do the CDC guidelines. And even if that weren't in place, our position is, as people of faith or as people of goodwill, we don't have any faith, we're trying to do no harm and stop any future spread. And that's just in our experience and what we've advised leaders and clergy.
I imagine, Pastor Zach, we probably should be wrapping up here. We promised that it would be half an hour, and there may be a couple of closing things you'd like to say, or there may be one more question we need to have asked, and then we can wrap it up.
I'd rather give a chance for another question, then we can wrap it. That's great. Lucas?
Yes, sir. Just trying to, what is the current guideline or guidance being encouraged for gathering size? I think there's a common theme of really wanting to define what social distancing is in 1610, and there's 25% for restaurants. And so what should their guidance be, and what recommendations do we have for them as it relates to that?
I do know I was sitting in on some task force committee. Those restaurants, they have to have people back to back, almost a panoramic social distancing, not just to the side. And so I do know that's important. I don't know if Dr. Pino would like to make further comment on this particular question.
Could you repeat, please? Could you repeat the question, please?
Yeah, so the question in essence goes to what is the definition of social distancing for their services?
Yeah, that's a new concept.
And then they've seen 25% capacity with respect to restaurants. They're just trying to really pin down maybe what would be a comfortable recommendation from health-wise or from a health standpoint on them moving forward with that.
So I really don't feel comfortable getting into a debate on the regulations that have been in place by the state. I think they all apply in general, and social distance in this case have been defined as 6 feet. But it's a new concept in general. All this started with the Ebola pandemic. We have developed new concepts in isolation and quarantine and self-isolation and monitoring, and all the concepts that has been developed that are quite different than they were before. But it applies to everyone, and it is what it is. Now, the churches were exempt. The houses of worship, I believe, they were not part of the executive order. They were exempt from those restrictions if they decide to. But there is also a level of social responsibility onto what our responsibilities as individuals and as leaders. But we're not trying to churches and the people of faith of what to do with their faith and their religion when they have the freedom of assembly, which is guaranteed in the Constitution. So what the CDC has recommended is what we will follow. No more nor less than that from a public health perspective.
I think we've run out of time, but our panelists may have something that is just percolating in them that they would like to share. And so if any of you have a 30-second soundbite, or all of you have a 30-second soundbite that you'd like to give, this is the one opportunity to get something said. Let's give you the chance to do that. Let's keep it Keep it succinct, and this is what you want people to go away thinking about.
Jim,
So,
this is Danny DeArmas, and my perspective, just if I would be more appealing to our government leaders, just the importance and the validity of our houses of worship opening. It's such a critical part of our community, and I think people are missing. Not I think people are missing this more than they are the opportunity to go eat at a restaurant, and this can create such goodwill in the community as soon as it's safe enough for us to gather with all the protocols in place. We can motivate our people to do that. We just want the green light to move forward, and we're praying for our government leaders to know the right steps to take and the timing as well.
thank you very much. Dr. Pino.
So, thank you very much. It was really the prayer. Your prayer at the beginning was very powerful, and we are on this together. No matter what we do, who we are, if we don't do it together, if we don't all do it, it will not happen. As we keep saying, a pandemic and an outbreak, it starts with one person, and one person, only one person, can start a whole pandemic. So we have to be careful. I think that we all agree that we need a sense of normalcy to be able to recover emotionally, psychologically, and also economically. And all those are important. And in my personal case, I'm all forward for opening as long as we do it safely and as long as we try to minimize the risk as much as we can. We are going to see a rebound no matter what we do. How big that rebound is the critical question. So the better we are at it, the less likely is that that's going to be elevated or significant.
Thank you. And Mayor Demings, your chance now. Have we lost Mayor Demings? He may be getting information from the governor or the president or someone like that. So Pastor Zach, there may be some other things that you want to make sure that are shared that haven't been shared yet.
So I just want to express my appreciation and thanks to the faith community for gathering in this format, and hopefully we can pull something like this together again. Help us spread the news about best practices to those in your governance, jurisdiction, denomination, affiliations, so that we can make sure that everybody gets exposed to best practices. That's really vitally important, because I think it's an estimate that it's some 1,500 faith-based communities in this area, and approximately almost 400 signed up for this today. I'm hoping that we can have a ripple effect in the community to share best practices. Thank you for the opportunity.
Mayor Demings, did you want to offer any closing comment? Can't hear him. Okay. Well, just to reiterate, we just want to let you know that we'll go through all of the questions in the chat, and that we'll try and get a comprehensive response. There's a lot of different themes that we see here that we can provide some responses to. So look for an immediate follow-up email with the mayor's executive order and some other quick resources that have been shared, like the 7 guidelines for reopening today. And then we'll go through these chats and get appropriate responses and ensure that everyone that registered for this meeting has the opportunity to benefit from the resources that were a part of the meeting and that will come as a result of some of the questions, honestly, that we've been able to see. So with that, we'll turn it back over to you, Pastor Zach, Pastor Jim, to close this out.
Okay, anything else, Pastor Zach, or do you want me to tie it up?
Please feel
Can
free.
you hear me now?
Okay, Mayor Demings is back on.
We have the mayor.
Right.
Okay. I'm sorry. We had a technical glitch here. I was trying to speak to you, but let me just say this to all of you and to everyone on the line, that as a man of faith, I do believe in a higher calling and a higher power. So I would ask that all of you just pray for your government leaders, that they have the wisdom to make the right decisions on your behalf, and that you continue to pray for the people in our great nation that is experiencing the pandemic. And then lastly, I believe that as we reopen, we have to restore some confidence in our citizens to feel comfortable re-engaging in the public with a new normal to deal with the fears that perhaps they may have. Mm-hmm. And so what I say to you there is that we have endeavored to try to understand that as we make decisions. We do have a survey that we have posted on our website at the ocfl.net website regarding consumer confidence. And we're asking all of our citizens to participate in that process that will help to give us guidance by which to make decisions in the immediate future as we go forward. And lastly, let me say to all of you, thank you for taking time out of your busy days to participate in this town hall meeting. Hopefully it has been instructive for all of you. We will chronicle the questions and put up a post that addresses your questions. And thank you for what you do in this community to deal with the anxiety that our citizens are experiencing. As faith leaders, I look to you and your leadership to help us deal with the mental anguish and everything that we have endured. And we look forward to reopening the congregations and the various places of business and places of worship with the guiding principle that we want to do so as safely as we possibly can. So again, thank you all for joining us.
You need to unmute Pastor Coffin.
Okay. Thank you very much, Mayor Demings, for making this a part of your schedule. And we appreciate hearing your input, and we appreciate your leadership. And the little sermon that I would leave people with is just a golden rule thing, that we want to treat others the way we would want to be treated. And so in all of our actions, if we're thinking about not just how much does this please me, but how much does this protect others, I think that we'll be on the right track. Thank you, and I'm going to leave it with you now, Pastor Zach.
Thank you. Let's pray. Thank you, God, for your many blessings and your benefits and your strength and your establishing of communities of faith that honor you. We ask that you would give us insight, wisdom, direction, guidance in our various places of service so that we can honor you and bless your people, establish communities of love and faith. In your name we pray. Amen. Thank you all again.
Have a great day.